Welcome, doctors. Let's take a moment to talk about something that's quietly reshaping the way we care for our senior patients and could soon be adding a new layer of complexity to your practice. Medicare has introduced a pilot program called the WISeR model, and it's not just a policy update. It's a signal that more red tape is coming, and it's starting with 6 states: Arizona, Texas, Oklahoma, Ohio, Washington, and New Jersey. If you've been working with traditional Medicare, you know one of its biggest advantages has always been the lack of prior authorization requirements for most services. That's changing. Under the WISeR model, more than 17 types of services including electrical nerve stimulation, injections for chronic pain, brain stimulation for Parkinson's, urology procedures, and even certain surgeries will now require prior approval. And while emergency treatments are excluded, most of the services we rely on to manage chronic conditions will be caught in this new web. Now, we all understand the logic behind it. CMS says this move is aimed at reducing fraud, misuse, and unnecessary procedures. They're using AI tools and physician reviewers to make these decisions. But here's what matters to us on the ground: delays, denials, and the constant back and forth with Medicare could now become a daily hurdle. This means more time spent on paperwork, more pressure on your front office, and more risk of treatment delays that could affect your patients' outcomes and your clinic's cash flow. And let's be real. We've already seen how this plays out in Medicare Advantage. It's tedious, frustrating, and often leads to burnout, not just for admin staff, but for providers too. This is exactly where Staffingly comes in. We've been helping healthcare providers like you navigate prior authorizations for years. With our trained virtual teams handling everything from documentation to follow-ups, we take the entire process off your plate. Whether it's coordinating with Medicare, dealing with payer portals, or pushing back on denials, our specialists manage it all quickly, accurately, and fully aligned with your practice's workflow. By outsourcing this function to Staffingly, your team doesn't get bogged down. You can focus on providing care while we handle the behind-the-scenes work to get your authorizations approved faster. And because we also support eligibility checks, RCM, and EHR documentation, we can help make sure your entire back office runs smoother. Doctors, the WISeR model is just the beginning. If this pilot succeeds, you can expect it to go national. So now's the time to prepare. Don't let your practice get caught off guard. Partner with Staffingly and stay ahead of the change, not behind it. Let us know your thoughts in the below comments section. Please like, share, and subscribe. Thanks for tuning into Staffingly, Inc.